Good evening, guys. I've got discussion C for you. Now we're gonna discuss the the caregiving crisis that the U.S. has right now. Shortages as to caregivers. We're gonna go into training details. So please join me for tonight's discussion C. America's caregiving crisis. Okay, here we go. Title: America's Caregiving Crisis is Getting Worse. Highlights key findings from the 2025 report by AARP and the National Alliance for Caregiving. Here are the main points. Rising numbers of caregivers. 63 million Americans now serve as caregivers, nearly 1 in 4 adults. This marks a 45% increase over the past decade, from 43.5 million in 2015 to 63 million in 2025. Nearly 17 million belong to the sandwich generation, caring for both children and aging or disabled adults, up from 11 million in 2015. Financial strain. Give me 1 second, guys. Almost half of caregivers face serious financial challenges, including depleted savings, debt accumulation, difficulty affording essentials like food and housing. 8 million caregivers depend on Medicaid for their own health care. 11 million receive payments through home and community-based services programs. Uh, Emotional and physical toll. 1 in 5 caregivers report poor or fair personal health. Nearly 25% feel completely isolated. Despite hardships, 51% say caregiving gives them a sense of purpose, in increasing complexity of care. Family caregivers are providing more complex and high intensity care than ever before. Many lack adequate training to manage these responsibilities. Would you like to explore how these trends intersect with frailty aware care models or smart housing interventions or innovations? Caregiving trends in the US, especially the rise in high intensity unpaid care, are deeply intertwined with the principles of frailty aware care models. Here's how they connect. Key intersections between caregiving trends and frailty-aware models. 1. Complexity of care matches frailty needs. Trend: caregivers are increasingly managing complex medical tasks without formal training. Frailty-aware response: these models emphasize early identification of frailty and tailored interventions such as physical rehabilitation, cognitive support, and nutritional strategies. Implication: frailty-aware frameworks can guide caregivers in prioritizing interventions that slow decline and reduce hospitalizations. Multidimensional assessment aligns with caregiver burden. Trend: caregivers report emotional strain, isolation, and poor health. Frailty-aware response: these models assess not just physical decline, but also psychological, social, and cognitive uh, dimensions. Implication: integrating caregiver well-being into frailty assessment could improve outcomes for both parties. System fragmentation minor mirrors caregiver challenges. Trend: many caregivers navigate fragmented systems with little coordination. Frailty-aware response: integrated care models aim to bridge the gaps between primary, community, and specialty care. Implication: these models can reduce caregiver stress by streamlining care pathways and improving communication. Sandwich generation needs dual frailty strategies. Trend: 17 million caregivers support both children and aging adults. Frailty-aware response models increasingly recognize intergenerational dynamics and the need for flexible, family-centered care plans. Implication: frailty-aware systems could offer scalable interventions and adapt to multi-generational caregiving contexts. Would you like to dive deeper into how frailty-aware models could adapt for smart housing or community-based tech solutions, or explore how caregiver training could be redesigned using these principles? Future trends in caregiving related to frailty-aware care models are evolving rapidly in response to demographic shifts, technological innovation, and systematic healthcare changes or challenges. Here's a synthesis of emerging directions. Okay, future trends in caregiving and frailty-aware models. Integrated care systems. Trend horizon scanning identifies new models that bridge primary, community, and specialty care to reduce fragmentation. Implication. Frailty-aware models will increasingly be embedded in integrated systems that support seamlessness, transitions, and coordinated care. Personalized, multidimensional interventions. Trend future models emphasize tailored care plans addressing physical and cognitive, psychological, and nutritional domains. Implication. Caregivers will be supported with decision tools that match innovations and individual frailty profiles, improving outcomes and reducing burden. Three, technology enhanced monitoring. Trend use of proactive algorithms, wearable sensors, and smart housing to detect early signs of frailty and intervene proactively. Implication. Caregivers will rely more on tech-enabled insights to manage risks and personalized care, especially in home settings. Expanded role of caregivers in clinical decision making. Trend frailty aware models increasingly recognize caregivers as co-navigators in care planning. Implication. Training and support systems will evolve to empower caregivers with clinical literacy and shared decision-making frameworks. Community-based frailty prevention. Trend emphasis on upstream interventions like mobility programs, nutrition support, and social engagement. Implication. Caregivers will shift toward prevention and resilience building, with community health workers and peer networks playing a large roles. Six, standardization and scalability. Trends, efforts to define and validate frailty assessment tools across settings are gaining momentum. Implications. Scalable models will enable consistent frailty screening and intervention across diverse populations and demographics, geographies. Would you like to explore how these trends could be applied to smart housing environments or caregiver education programs, or perhaps delve into how proactive analysis might reshape frailty detection. Proactive analysis is proposed to transform frailty detection by enabling earlier, more precise and personalized interventions. Here's how. How predictive analysis could reshape frailty detections or detection. Okay. Early identification using machine learning. Algorithms like support vector machines or SVM, random forecasts or RF, and logistic regression or RL can analyze electronic health records to detect frailty before clinical symptoms manifest. In one study, SVM achieved an Iraq of 78% precision of 94.5% and F1 score of 82.1 for frailty protection using 21 clinical features. Multidimensional risk profiling. Proactive models can incorporate diverse data, lab results, a mobility matrix, cognitive scores, and social factors. This aligns with Frailty Aware Care's emphasis on physical, cognitive, and psychosocial domains. Demographic trajectory forecasting. Longitudinal models can predict frailty progression over time, identifying individuals at risk of transitioning from pre-frail to frail. This supports proactive care planning and resource allocation. Wearable sensor integration. Gait speed, sleep size, or step size, and walking distance captured via wearable sensors are strong predictors of frailty. Combining sensor data with clinical assessments improves prediction accuracy, which is an AUC up to 0.93. Okay, personalized intervention triggers. Predictive analysis can flag when a patient's frailty risk exceeds a threshold, prompting tailored interventions like nutrition support, physical therapy, or social engagement. Scalable screening in community settings. Algorithms trained on large data sets can be deployed in primary care or smart housing environments to screen older adults efficiently and cost effectively. Would you like to explore how these proactive models could be integrated into caregiving training or smart housing platforms, or perhaps compare different frailty assessment tools in machine learning studies? Okay, guys, so that is it for tonight. I will see everybody tomorrow for shows. For now, Gator Wellness. Take care, folks. Enjoy evening. See you tomorrow for shows. Take care.